Good afternoon, everybody, and thanks for joining us at Valley Children's for a virtual health series on COVID-19. It's been a while since we've had one of these. Doctors like Dr. Niall Mason here have been super busy, as you can imagine, with COVID-19. I'm Zara Arboleta at home. Dr. Mason's in his office, and we are here to talk about so many questions that people have about COVID-19, vaccines, and also the Omicron variant. Dr. Mason, good afternoon. Thanks for joining us.
Good afternoon. Thank you, Zara.
I know it's been a while, and even since our last Facebook Live a few months ago, it feels like the whole world has done another 180. And I wonder if you want to start for people who are joining us on Facebook right now. And for those of you who are tuning in, feel free to drop your questions or comments in the comment section, and we'll get to them. Dr. Mason, why don't you just kind of give us like a state of COVID right now to start out with?
So as many of you know, what we're dealing with right now is another surge of COVID-19. This particular surge is associated with the variant that's called Omicron. And this variant is rather unique, actually, different than some of the other variants that we dealt with before, in the sense that it's more contagious, at least 2 or 3 times more contagious than the Delta variant, for example. The Delta variant is what we dealt with this past summer and early fall. The good news about the Omicron variant is that it's not as associated with severe disease as some of the other variants that were before it. So it looks like as this virus is evolving and mutating, it's moving into a more contagious but less severe virus. And that has its pros and cons. Again, it's good that it's not as severe, but also because of how more contagious it is, we're seeing more and more numbers. And naturally, just by sheer numbers, if you have an average of 1 million people a day getting the infection, some of those, unfortunately, will have some other comorbidities that will put them at risk for severe disease. So based on these high numbers, most hospitals in the US, they actually reach capacity. I heard that that news actually last week as I was driving to work on NPR, is that US hospitals were at their all-time maximum capacity. And many hospitals are still dealing with that high surge, with the consequences of it. The thing that we have to keep in mind is not just the cases that are coming to the hospital and requiring admission and hospital and ICU admission, but also the other medical conditions that we deal with in general. For example, most children's hospitals are busy during the winter season because of the respiratory viruses that are already common during the fall and winter time, such as RSV and influenza, rhinovirus, enterovirus, parainfluenza. So for example, Valley Children's has been busy relatively when it comes to these infections and other complications of them, and also other medical conditions. And then when you add to it more and more numbers because of COVID-19, then that adds extra challenging to the care that we have to provide for our patients. The other thing to keep in mind is also the safety of our apologies, that's my phone. The safety of our staff, and also some of them will have to isolate or quarantine for exposure or for infection. So again, it's been really interesting, and fortunately more and more cases. Luckily, most are mild, but still some are require hospital admission. The numbers of the cases are starting to decline, only now actually beginning to decline in the state of California. And they were starting to decline starting last week on the East Coast. So hopefully over the next few days, what we're anticipating is to see less and less of these numbers. But at the moment, it's still actually, the surge is still at its peak here in California.
So at Valley Children's, the positivity rate jumped over the last 2 weeks considerably, as you know, as did the number of hospitalizations. But again, that's only a snapshot of one portion of our patient population. Like you were saying, Dr. Mason, the majority of our patients who are testing positive for COVID-19 coming in and then testing positive for COVID-19, they are able to go home. But what kinds of symptoms are you seeing in those kids? I'm not talking about the ones who require acute care and might need hospitalization. But for the majority of kids who are testing positive, they feel kind of crummy. What kinds of symptoms are you seeing in them?
So fever and body aches, these two are probably the most common. And then just like any other cold virus, what we're seeing is cough, runny nose, sore throat. Some of these patients get headache as well. Some of them get some gastrointestinal symptoms of things like throwing up or having diarrhea. So these are the common symptoms that we're seeing. The rare presentations of this is when someone gets a complication affecting their heart. So people talk about myocarditis, for example, and that's the inflammation of the heart. So that's one of the rare complications of getting COVID that actually the vaccine can prevent.
The other thing too is the majority of kids, at least that we take care of at Valley Children's, are not eligible to get vaccinated yet. For the kids 5 and up who are vaccinated, you see this on social media all the time. There are parents and other people who are maybe not quite as supportive of vaccines, who then say, well, look, these vaccinated kids are getting COVID-19, so it's not working. You want to remind people again what the vaccines actually are intended to do.
Right. So unfortunately, some of us think about the vaccine or a lot of these protective measures as a binary option, as a switch on, off. If I get the vaccine, it's off. I'm not going to get the infection. If I don't get it, I'm still at risk. It's more like a dial. So when someone gets the vaccine and you get the booster, they're dialing down the risk of getting COVID. So it's not necessarily going down to zero, but the chances of getting COVID is becoming much less. The chances of getting severe illness because of COVID is getting much less. I mean, the data on this is obvious. When you look at the curves, for example, of the number of COVID cases requiring hospitalizations, and you compare those by the status of vaccination, it's very obvious. Individuals who are unvaccinated, they have significantly higher risk of needing hospitalization, of getting to the ICU, or unfortunately of dying because of COVID compared to the ones that are vaccinated. So every dose of the vaccine dials down your risk even less. The booster is dialing down your chances of getting the infection or getting severely sick by it. And then when you add to it other things such as wearing a mask, social distancing, and hygiene, staying home or sick, staying away from people who are sick, when you add all of these measures together, then that's dialing down your risk of getting sick of the virus significantly lower than the rest of the population.
All right, so we started soliciting questions from people last week, and we have lots of them. A mom here of a newborn and a toddler wants to know, how in the world can already worried parents tell the difference between a cold, the flu, or COVID? I mean, especially with the Omicron variant, which makes everything seem milder, relatively speaking. But how can you tell which is which? You know, for parents, it's extremely worrisome, right, and stressful.
Unfortunately, there's no way of anyone to tell just on their own, oh, this is COVID versus RSV versus some other cold virus. The only way to tell is really doing the test. So there's nothing unique in terms of signs and symptoms that can tell you. Perhaps the one that it's maybe the most unique is the loss of taste and smell, but obviously a newborn isn't going to tell you that. So getting tested is probably the only way to tell for sure whether someone has COVID or not. And now we have more availability of testing. There are the home kits, the rapid test, and also you can get the regular PCR test through several facilities and clinics here in the area as well.
You know, that's a tough part too. I know that the federal government, Fresno County and some other counties are trying to get the at-home antigen kits to parents. But the thing to note about at-home kits is, talk to me a bit about how that really is just showing you your viral load in that specific moment of time.
Right. I think for any test, that's one thing that you have to keep in mind, that if the test is positive or negative at the time, it just tells you that particles of the virus were detected or were not detected in your nose at that time when you did the test. It does not necessarily tell you that, no, you don't have it, you're not going to have it forever. Because I hear that sometimes, you know, someone is exposed, they have some symptoms, they get a test and it's negative. And they say, oh, well, I don't have it. And then they just keep going, mingling with others, not necessarily taking precautions. I don't think that's the right thing to do. I think if someone is symptomatic, any symptoms period, you have to be very careful, because sometimes these tests do not pick up enough of the particles of the virus to become positive, even if someone truly has the infection. especially regarding the timing of when you get the testing done. So if it's done too early, maybe the test will be falsely negative. Sometimes if it's done too late, can also be done falsely negative. It's really about doing the test at the right time, and that right time is not necessarily obvious. So I think being cautious in general is a good idea. And again, if you have symptoms, just consult with your primary care provider, and then they should give you exact directions about the right test and the right time to find out whether someone has COVID or not, or what other precautions they need to take in terms of isolation or quarantine.
And then I heard that sometimes even after you're exposed to COVID-19, it can be 5 to 10 days before it might even show up in your system.
That is correct. Yes. So again, the timing of exposure to symptoms to test positivity, these times, they really vary from one case to another. And yes, it could be a few days.
Okay. A question that came in through Instagram was, if you get, say, the Omicron variant of COVID and you recover, is it possible right after that to then get COVID again, but you have the Delta variant this time?
It's actually possible. So reinfection is possible, whether it's the same variant or a different variant. We have been seeing some cases of reinfection. Luckily, they're not common, but it could happen. And that's why even if someone had COVID before, they still need to get vaccinated, just again, to dial down the risk of getting reinfected. So yes, it's quite possible, because as this virus is mutating and changing, it's going to try to escape the immunity that the body will make after getting the infection. And similarly, it will try to escape the immunity from the vaccine. And that's one of the reasons of trying to get these boosters, especially, again, as you hear now, there are plans of changing these boosters to actually make them more directed toward these newer variants. There are none of these vaccines now have changed so far. They're still the same ones. There's work ongoing. There's studies ongoing to evaluate the need for changing or tweaking these vaccines to make them more effective against the newer variants of the virus.
Speaking of that, I mean, you and I are fully vaccinated and boosted. So there have been a few questions saying, do you anticipate a fourth dose being needed? Because at a certain point, Dr. Mason, it's hard not to feel fatigue, like, oh, I need another one. I mean, I know I should get it, right, but at the same time, it's like, oh, I felt bad after I got it. And are we gonna need one every 3 months, every 6 months? What are you hearing?
I think it's possible. Again, there's no firm data yet. We're all waiting the results of the studies evaluating that. We're all waiting for the official guidelines from the CDC. But I will not be surprised if there are recommendations for another booster, say in 5 or 6 months from the previous one.
Okay, back to vaccines for kids. There were a large number of questions that came in. Late last year, the FDA authorized for emergency use the vaccine Pfizer in kids 5 to 11. Previously, over the summer last year, they upped it, or they allowed 12 to 15. So what do you want to say to parents of children in this younger bracket, this 5 to 11 bracket, who are still feeling a bit worried about giving the Pfizer booster vaccine to their younger kids?
What I tell them is that look at the data. I mean, it's obvious that this vaccine, based on the data that we have so far, whether it's the study that was submitted to the FDA for authorization or the real life data that we're gathering so far since the authorization, it's obvious that these vaccines are safe and effective. We have not seen any safety signals to say that, you know what, this vaccine is actually causing harm to that population. And in fact, in terms even of side effects, because that dose is 1/3 of the dose of the vaccine for older children and adults, looks like there's side effects that a lot of us experienced after getting the vaccine. The side effects of like some low-grade fever, chills, all that, looks like these are actually much less in children 5 to 11 compared to their peers who are older or in adults. And then again, in terms of efficacy, once again, what we're seeing so far is that individuals who are vaccinated have significantly lower risk of needing hospitalization, of needing ICU admission, or dying because of COVID compared to the ones who are unvaccinated. So on both fronts, the safety and the efficacy the data numbers are actually very, very promising. And then on a personal level, I mean, my son who's 6.5, he got vaccinated. He did really, really well. I'm very happy that, he was able to get that extra layer of protection. And similarly, many of my colleagues who have children in that age group, they also got their vaccines. And I've not heard personally any bad outcome, any negative side effects from those. It's all has been actually very, very positive feedback.
Yeah, my 13-year-old felt nothing after either dose. My 12-year-old felt a little tired after the second dose, but then bounced right back. They handled it much better, I feel, than I did.
Right. Kids are resilient. That we see that a lot. But I think also the lower dose probably has something to do with it.
So a question for you then, from a mom of a 3-year-old, of a child who's medically complex. Are you hearing word of when the boosters for 4 and younger might get approved? I'm sorry, not boosters, vaccine. Yes, the vaccines.
So there's nothing official yet. Looks like the Pfizer vaccine is going to be the one that's going to submit data on children 6 months of age till 5 years of age. And we're anticipating this over the next few months or so. And then, as usual, after that, that will require a careful evaluation by the FDA and a careful evaluation by the CDC to make recommendations. So we don't have an exact timeline to all of these things. A lot of it is actually a moving target, depending on when they conclude the recruitment or their enrollment of the study participants, and also when they get enough data to submit to the FDA. I'm hoping that we get this actually by May or June, but we'll wait and see.
Okay. Sounds like we have quite a few parents from the Wilson Heart Center who are tuning in today. We've received several questions about my daughter has a heart murmur, or my child needs to undergo heart surgery. What do you want to tell them if they have questions about the vaccine and when the right time might be for their child to receive the vaccine?
For anyone who, let's use that term, medically complex, or has some other conditions that require frequent care by a healthcare specialist, it's always good to consult with your primary care doctor just to make that decision based on the specific case that your child has. So I just have to say that as a disclaimer. The other side to this question is that also, if someone has comorbidities, someone has other medical conditions that require the care of a healthcare specialist, then that could automatically put them at an increased risk of severe COVID. And in these cases, you really want to do everything you can to decrease the chances of getting COVID or having that child get COVID. And that's where the importance of the vaccine comes in. So my daughter has a heart condition. She's 2.5. She's still not due for, or she's not eligible for the vaccine yet. But I'm also, just like many other parents of medically complex patients, I'm really waiting for the vaccine to be authorized for someone in her age group to give her that extra layer of protection. It's actually more important for someone with a heart condition, say, let's say that based on the question, to look for their options for all of these tools that you can use to decrease the chance of getting COVID. And the vaccine so far seems like it's an excellent tool, excellent weapon that we have to fight the spread of this pandemic. So again, consult with your doctor just to make sure that your child does not have a specific condition that's a contraindication to the vaccine. And if your doctor says, no, there's no contraindication, then by all means, you should go ahead and find a clinic or a center where your child can get their immunization. Again, there is no association between having a congenital heart disease, for example, and having a contraindication for the vaccine.
Okay. There were a couple of parents who wanted to know, if my child had COVID, how soon after that can they get the vaccine?
So the CDC guideline is that it says that someone has to wait until they're fully recovered and out of isolation from COVID before they can get the vaccine or the booster. Typically, that takes around 10 days from the day of the start of the symptoms or from the day of the positive test. Again, give or take. And in these cases, once again, it's always good to consult with your doctor or primary care provider before you decide on getting the vaccine.
Because the old window used to be 90 days after infection, don't get the vaccine, but sounds like that's long gone.
So yeah, a few months ago, actually, that recommendation was updated by the CDC, and now they say you have to wait until you're fully recovered, and it's, again, typically around 10 days.
Okay. Someone has a child. Let's see. Someone's asking, what types of medical concerns qualify a child in the 5 to 11 age bracket for the third dose for immunocompromised children? So it sounds like I'm wondering what qualifies as a booster for that age bracket.
Right. So again, it has not been 5 months yet from when that age group was authorized to get the vaccine. But as we get closer to this, then some children who would qualify for the boosters are the ones that have high risk of severe disease, such as immunocompromising conditions. And again, there is a list of criteria of who qualifies for that and who doesn't. It really depends on the severity of their immunocompromising conditions. So if someone thinks that their child would qualify for this, then please discuss that with your primary care provider to see whether the child would really fit that criteria.
Okay, yeah, that goes aligned with another question that just came in on Facebook. Does chronic asthma use of inhaled corticosteroids count as immunocompromised for the purpose of getting a third Pfizer dose?
It may, again, depending on how often these medications are needed, how often the child is getting asthma attacks.
Someone's asking, what is the window of time that a COVID positive person can expose others, even if they are asymptomatic?
So typically someone is contagious 10 days from the beginning of their symptoms, or 10 days from the when they tested positive. That's the average time. Sometimes it's a little longer, sometimes it's a little less. The challenging part is the ability to transmit the infection before someone has symptoms, before someone tests to find out whether they have the infection or not. So it is possible for someone to transmit the infection before they even start feeling any symptoms. That's what's called silent transmission. And that's probably one of the most dangerous parts about this virus is, again, the ability of someone to transmit the infection before they even know it.
I feel like you just answered this next question. Is it possible for a child to have COVID twice with little to no symptoms?
It is possible, yes. So again, reinfection is possible. And then the presentation, meaning how severe or mild the presentation is different from one person to another. It seems like children typically have milder presentation compared to older peers or to adults.
How soon after a full series of the Pfizer vaccine can a child get a third dose?
So the recommended duration is minimum of 5 months. So after completing the series, 5 months after that, someone is eligible to get the booster.
Okay. As you've mentioned, since day one of this pandemic, which seems like 90 years ago, there's really no cure for COVID. It's about helping to manage the symptoms. So some parents are asking, what are some over-the-counter medications, at-home remedies that might be able to help you or your child if you test positive and you're suffering at home now?
Right. So I'm gonna take a step before that. Is there something that someone can do to boost their immunity so they don't get the virus? The answer is yes. That's what these are the vaccines. That's what the vaccine does. It really literally boosts your immunity so you don't get sick. So that's one. Things like vitamins and minerals and zinc, a lot of people take them thinking they're boosting immunity. There's really no evidence they do any of that. If you're someone who takes vitamins anyway, that's fine. You can continue doing that. But again, there's no evidence that taking multivitamins, vitamin C or zinc will boost your immunity and help you overcome or not get COVID. So that's one. If someone has COVID and they have some mild symptoms that are at home, then some of the things that they can do to make sure they recover quickly is rest, because again, as your body's fighting the infection, it's going to use a lot of the energy trying to fight that battle again against the virus. So rest, hydration is important, again, to help all the body functions. And then some over-the-counter medication that can be given, things like acetaminophen or ibuprofen. So these are Tylenol and Motrin. So taking these things for pain or for fever can also be helpful. And then beyond that, if you feel like your symptoms are worse, more severe than that, and you need to consult with your doctor, then that will be a time for your doctor, or if someone again need to be in the hospital, that will be a time for the doctor caring for them to decide whether they need some of the other medications that we have for COVID or not. And yes, as you said, Zara, we don't have necessarily curative medications for COVID, but there are some medications that we can use. There are some antivirals that are approved for treatment of COVID for someone who's in the hospital. There are also some medications that are authorized to give to patients that are not even in the hospital, just to prevent them from progressing into severe disease requiring hospitalization. So we have at least 3 or 4 medications or therapeutic options that we can give individuals at home or again at an infusion center to make sure they do not progress into or to decrease the chances of them progressing into severe disease. Probably many of you heard of the monoclonal antibody. These are the antibody cocktails similar to what ex-President Trump got. These are things that are also shown to help decrease the chances of progressing into severe disease. And many of these things, many of these therapeutic options are available. There's now a pill as well that some doctors can prescribe for some patients who have high risk to decrease their chances into progressing into severe disease. So yes, we have some therapeutic options. Yes, the treatment is mostly supportive, rest, hydration, over-the-counter painkillers, and fever-reducing medications. But in some of these cases that require more medical attention, and we do have some options now. We do have some therapeutic options that can be considered.
So when should a parent start getting concerned? I know that you and other specialists at Valley Children's always say no one knows a child better than their own mom or dad, and so you know you don't want to be too much of a hypochondriac if your child is sick, but at the same time, are there any key symptoms that you say, you know what, if your child has a high fever for 3 days, I don't know what it might be. When is it time to call the doctor?
So, I mean, there are several signs, and it's always good to consult with your primary care provider if you're not sure. There's no harm in doing that, picking up the phone, calling the clinic, and just telling them, hey, my child has this. What do you think? Do I need to worry or not? I think that's always good. So you have that specific recommendation for the specific condition that your child has. So that's always important. But in general, if the child is not able to drink any fluids, so not eating, not drinking, to the point where they are starting to look dehydrated, then that's obviously a reason to again call your doctor or just bring them to the emergency room department. If the child is having difficulty breathing, if they're breathing fast, moving their chest rapidly, gasping for air, starting to look pale or blue, then obviously that's a reason to either call the ambulance or just bring them to the emergency room department. So these are some of at least these 2 things. So hydration or dehydration in this case, and difficulty breathing. These are probably the 2 most important things to keep in mind. But if it's just some cough, some runny nose, a little bit tired, a little bit decreased appetite, maybe some headache, most of these things can be handled at home. But again, you don't want to take chances. You can always call your primary care provider and check with them.
Okay. Someone asks, what about a 7-month-old baby who was exposed but has no symptoms so far? How can we boost her immune system, if at all?
There isn't, again, anything necessarily that you can give someone at that age to boost their immune system. And unfortunately, the vaccine is not authorized for someone at that age. But what you can do is watch for symptoms. Again, make sure they're well hydrated. And then if they have any symptoms, then, excuse me, at that point, they can be tested.
Okay. Sorry, someone had a data question. So I'm trying to look up our data for the last few weeks. There have been a couple of questions from pregnant women and women who are trying to conceive. Is it safe for them to receive the COVID-19 vaccine?
Yes, so we can say that now more confidently, that we've had experience with these vaccines for over a year now, and they were studied in pregnant women. It really does appear that it is safe. I think pregnant women should be more keen of trying to get their vaccine, more so than someone who's not pregnant, not only to protect themselves, but also to protect their babies. We do know how severe COVID can be on pregnant women. I mean, it's obvious now. It's associated with complications on the mother herself. It's also associated with complications on the baby, such as premature birth or some other complications. So when the pregnant mother is taking the vaccine, not only she's protecting herself, but also protecting her baby. I personally have seen, and many of my colleagues have seen, pregnant women getting really sick because of COVID. I've seen babies needing ICU admission right after birth because of COVID or its complications. So again, it's safe, it's effective, it's something I recommend to any pregnant woman, especially after consulting with her doctor.
Last year, we did another Facebook Live with some of the physicians from our maternal fetal center, and they echoed the same thing you said. They said they strongly recommended the vaccine for everyone, period, who's eligible.
Sure.
But they said especially for pregnant women, because the risk of complications should they contract COVID-19 were actually greater than general population.
Definitely, yes.
What about nursing moms? Is it okay for nursing moms to get the vaccine? Someone just put.
It is okay, yes. So there's no association with negative outcome for mothers who are nursing, so breastfeeding mother or their babies. If anything, it's also does help give their babies partial immunity. And that reminds me, maybe for that question before about the 7-month-old and how we can boost their immunity if they're breastfeeding, the baby is, and if the mother is vaccinated, some of these antibodies will actually go from the mother into the breast milk, into the baby. So here, that's
there you go. There you go. So kids are back in school, full force. But I know just my kids go to Clovis Unified, so I always check their dashboard. You see the numbers are up. So someone's asking, if my daughter comes home and tests positive, when should I get tested, or the other people in the household?
So ideally, you would actually wait and just monitor for symptoms. And again, that perfect timing of when you can get tested to find out whether you truly have it or not is not obvious. Most would say delay it 48 hours after exposure, because sometimes that's how long it takes to turn the test into positive or start having symptoms. But I would say testing before that is not going to give you a lot of value necessarily. And then testing at 5 days probably is a better reflection of whether someone has the infection or not. So I would say between day 2 to 5 after exposure.
Oops, muted. Someone just wrote in, my son was treated for COVID in November and was given remdesivir for treatment. When can he be vaccinated?
Oh, so anytime now. Again, we said once someone's fully recovered from the vaccine, whether they were given medication or not, they can go ahead and get the vaccine.
Okay. All right, Mom. So you can take your son in now to get vaccinated. Someone did ask, are we seeing a spike in pediatric cases at Valley Children's? Why don't you take the general, I have numbers, but why don't you speak to just generally what we're seeing at Valley Children's?
So our positivity rate increased significantly. So if you talk to my colleagues in the emergency room department, they would tell you at one point it was almost 30%. So that means, every third patient you test for COVID, they come back positive. It was just that common. And even on the inpatient side, I was covering the inpatient service for infectious diseases last week, and it was heavily busy actually with COVID cases. We've had increase in the number of children that needed to be admitted just for COVID, or patients who were in the hospital room who were found to have COVID throughout their admission. So again, these numbers are going up significantly. That's what the rest of the nation is seeing at the moment.
So I'm looking at the data trends right now. This is as of January 10th, so a few days ago. Early December, our positivity rate was around 2%. But the first week right after Christmas, it jumped to 19.2%. And as you mentioned, it's up even higher since then. And then hospitalizations, we've always been around 2 to 5 patients a week. But last week we had 11, and something that I've been seeing on social media, because the team I work with handles all the social media accounts, people keep saying, well, those 11 hospitalized kids, are they there for COVID, or are you lumping everybody who tests positive for COVID into that? And I want to make it clear to those of you watching at home, when we release our numbers for COVID-19 hospitalizations, those are for children whose primary diagnosis is COVID. So if a kid comes in for, I don't know, Dr. Mason, emergency appendectomy, and they happen to test positive, and they're hospitalized for a day or two after surgery. We're not counting that. Our numbers pretty much tripled in a week for hospitalizations directly related to COVID. And I don't know how many times we have to tell people, Dr. Mason, that we're not cooking the books here. These are actual numbers that we're seeing.
Right. No, I agree with you. And all of these cases, they actually matter. And sometimes, again, you find out that the patient has COVID while they're here for another reason, but sometimes a few days after that, it develops symptoms, and you have to care for them for that. So all of these cases do matter. All of them require specific kind of staffing, specific kind of what room we put them in, what isolation equipment we use for them. All of them actually take a toll on the resources that we have to care for our patients.
The other thing that I've been seeing on social media is, it kind of reminds me when I was a kid, and admittedly, my own parents, if they found out someone else had chickenpox, they'd be like, have a chickenpox party. I'm seeing this weird trend on social media where people are like, maybe I should, if someone has COVID, I should just intentionally try to get it now and get it over with. You want to explain why maybe that's not the best idea?
That makes me nervous. I mean, we all know the complications of COVID, and it's really impossible to predict who is going to get the complications versus who's going to just be sick for a few days and then get better. And it's not just about the acute illness. There are the long-term complications, the long-term signs and symptoms that we're seeing after COVID. And we see those in otherwise healthy individuals, just like we see them in someone who has risk factors for severe disease. Again, I've been consulted on several cases of what we call long haulers. So individuals who recover from the acute phase of COVID, but then after that, they have long-term complications. The loss of taste and smell that lasts for months and months, it just does not get better. The body aches, the chronic fatigue that lasts for months and months and does not get better. I don't think any of us want to risk getting something like this. So again, if you want to boost your immunity against COVID, we have the answer. It's the vaccine. It's not taking a risk of taking a chance of getting infected. It's not taking a chance of trying some experimental remedies that, again, we don't know whether they help or not. We don't know whether they're safe or not. So that's another thing I have to remind people. I think it's good if someone gets COVID and they recover. That's great. I think that's perfect. That's another way of getting immunity. It's the natural immunity. But we don't know that if someone gets the infection, it's just going to recover completely. So it's just a gamble there. I don't think anyone wants to gamble with their health.
Yeah, and the interesting thing too, early on, people kept saying, well, you're only at risk for severe COVID. This is before the vaccines were even out, if you have certain conditions. But a lot of those conditions, so many of us have. I have asthma. People are obese or they have diabetes. I think they forget that the threshold is pretty low, actually, when it comes to complications,
right?
What conditions qualify. And
it's not just that. It's not about our individual risk. I may be 100% healthy. I have zero risk factors, let's say that. But, I go shop, next to someone who has risk factors, and I give them the infection, or I take it home and my parents are old and they can get severe disease. And that's the thing, we're not living in a bubble, so we have to be mindful of people around us as well. We're in this all together. It's not just an individual risk, so we have to keep that in mind as well.
The CDC recently came out saying that cloth masks might not be effective and maybe switch to N95s or KN95s. One, any thoughts on that? And then two, people might not even be able to find those right now. So what are some practical tips you have for folks when it comes to masking in light of the latest guidelines?
Right. So the cloth masks were recommended where there were shortages. We didn't have enough of what we call the procedure masks. These are the things that look like this. But now that we have more of those, that's what the recommendation is. And if you want to add the extra layer of protection, then you can get the N95 or the N95 from someone who has to wear those N95 for an extended period of time at work. I can tell you they're not very comfortable. And when you have something on your face that's not very comfortable, you're going to be touching and moving, and that may increase the risk by touching the face with contaminated hands. So I think this is a happy medium, just a regular procedure mask, and you can find these everywhere. So I think that's probably a better option than some of the other things that people will use.
So you don't think necessarily right now people need to go out running out to get, I mean, I've warned them too when I've had to go into certain parts of the hospital, and yeah, they're not, they
They're not
are
the
not.
most comfortable. You don't have to. I think these are good enough. I mean, if you're someone who has access to higher level of protecting masks and you can wear them comfortably, then sure, by all means, why not? But if you're like me and like, you know, the rest of the population, I think these are good enough.
Okay. Someone's asking for the booster, is it the same formulation as the original, or do you think it might change like the flu shot does every year?
Looks like the goal is actually to change it, because as this virus is mutating, that efficacy that we're getting from the vaccine is going less and less, and that's expected. I mean, the virus is going to mutate to try to escape the immunity generated by the vaccine. So that's why we have to be also smart in that battle against the virus, and try to tweak these boosters to make sure they're more effective. So yes, there is work. I mean, many of these companies that are manufacturing these vaccines are also trialing an updated version of these boosters to see whether they can provide better protection against the newer variants or not. And again, we'll just wait and see, depending on what the studies show in terms of safety and efficacy.
Okay. Someone asked, I'm not sure. Well, it says, what about people who have bleeding disorders? Should they stay at home or can they work with this situation? So I'm not sure if that's specific to if you have a bleeding disorder and you get COVID or.
So I'm not sure. So again, bleeding disorders, there are a lot of them. Some of them are also associated with lower neutrophil count, or that's something that can affect the immunity. It makes these individuals immunocompromised. So again, I don't know exactly which bleeding disorder the question is asking about. It's probably better to consult with your primary care provider to see if they can give you specific recommendations. In general, if someone has any comorbidity, again, they should try their best to decrease their risk of getting infection by getting vaccinated, by wearing a mask, by doing hand hygiene frequently, by staying away from sick individuals, avoiding large gatherings, especially the ones indoor. But again, in terms of going to work or not, it really depends on the circumstances. I mean, the type of work that you do, and you know, are you able to be in your office with your door closed, or do you have to be in an open area where again you have to be very in close proximity with others? So I don't know. It seems like something worth discussing with your primary care provider.
So March will be 2 years now, 2 full years with this pandemic. And you and I have discussed many times through Facebook Live and even just in personal conversations, how polarizing COVID-19, everything about it has become. Right. Half the time, it's not even about science. It's just whatever your own, whatever, right? So someone's asking, how do you handle it when you have conflicts within your own house? So here's a person who wants to get her 2 children vaccinated. She and her husband are both vaccinated, but she says her husband doesn't think it's a good idea for the kids to get vaccinated. Her children are 12, 10, and 5. The pediatrician says yes. The family doctor says no for the kids. I think they're looking for a mediator here, Dr. Mason.
Right. I don't know. I think this is one of the situations where you have to talk about things logically. You have to maybe mention exact examples, maybe reference the data, reference the guidelines, have both parents discuss this with the doctor again, talk about the pros and the cons of the vaccine, the risk and benefit, because that's what this boils down to. It's really about that balance of risk and benefit. You may say, oh, well, we don't know 100% if the vaccine has side effects in 10 years from now. And yes, we don't know that, but we don't really anticipate any issues in that relation based on what we know about these vaccines. That's one. And second, the pandemic is right now. We can't wait 10 years to make up our minds. Like I'm stuck in a building that has fire and someone hands me the fire extinguisher and I tell them, oh, well, I don't want it. I want to do 10-year studies on the fire extinguisher before I use it. And, it doesn't make sense in that regard. This is a great tool that we have to fight this pandemic. And what we know about it so far is very, very promising in terms of safety and efficacy. So I really think that we should all be utilizing that tool unless someone obviously has a contraindication.
Mm-hmm. I think that's the hard part. For me, as soon as I qualified, I got my vaccine. When my kids fell into an age range where they were approved to receive the vaccine, I still had to have a talk not only with their pediatrician, but also with some of you at work. Like, is this a good idea? Obviously, overwhelmingly, my pediatrician, all of you said, yes, do it. But there is that difference. Me, I'm like, whatever. But, for my younger kids, I had to think, even me, with all the information I had to think twice and ask a lot of questions.
Believe me, as a parent, I relate. I mean, I understand. Again, I feel like a lot of us feel like, oh, we can do whatever for more resilient, we can do whatever. But when it comes to our children, we always want to do the best for them. And that's great. That's actually something that's commendable. But again, when you look at things objectively, when you look at the science, the data, the numbers, everything we have so far, it's very obvious that this is an excellent tool. This is something that every parent should really be considering for their children.
And then back to the worried mom's question here. Her pediatrician says yes. And for me, if my pediatrician tells me to do something, I believe her wholeheartedly. And so maybe it's just like you said, maybe it's worth she and her husband having a talk with the pediatrician to get all those questions answered. But it is a tiny bit scary because, like you said, Dr. Mason, we don't know 100% definitively what the long-term effects are, but we do know that right now they are extremely effective at keeping kids out of the hospital.
Sure. Yes.
And so that's important. Let me see. I think we actually, oh no, wait, I have a whole nother page of questions here. Hang on a second. My 15-year-old vaccinated son is asymptomatic but positive. How long does he isolate for?
So it's 10 days from the date of the positive test. That's the duration of isolation for someone who does not have symptoms. Now, if someone has symptoms, typically the isolation duration is 10 days from the beginning of the symptoms, as long as they are not having fevers anymore, and then as long as the rest of the symptoms are getting better. These are the guidelines for isolation from the CDC.
Someone just said their son is at Valley Children's right now for COVID and RSV. Are you able to test parents for COVID as well? Yes. So yes. So I do know the answer to this one. For those of you who currently have children in the hospital, you can speak to the charge nurse or to your child's doctor. We will arrange COVID testing for you if needed. And we will also arrange vaccines for you if needed. So that is something Valley Children's committed to months ago. So sorry, I took that one because I happen to know the answer to that one, Dr. Mason.
Perfect.
Can a child with anaphylactic allergies qualify for medical exemptions?
Maybe they can. So again, there's an algorithm for medical exemptions of who qualify and who does not. Especially for someone who has anaphylactic reaction to a component of the vaccine. And there's an algorithm by the CDC of actually how to find out whether someone is truly allergic to one of the components of the vaccine or not. So if someone's child has this, if again, the person asked this question, if you believe your child has this, then please consult with an allergy specialist so they can go through this algorithm to make sure whether it's safe or not for your child to get the vaccine.
Okay. Someone's asking, there are two questions related to this. What is the risk so far of adverse effects in kids from the vaccine? And has the vaccine helped significantly reduce the number of children being hospitalized? And there was another question that came in too, asking if the majority of kids we were seeing were vaccinated or not.
A majority are unvaccinated. So I mentioned that earlier during this session. I have not seen a single case in the hospital of someone who's severely ill because of COVID after their vaccination. I've seen, unfortunately, several who are severely ill because of COVID, and all of them were unvaccinated. So that's one. In terms of the efficacy of the vaccine, again, look at the recent numbers in California or even in the rest of the country on the CDC dashboard for COVID. They do list the number of cases, they do list the number of ICU admission, hospital admission, and death divided per the vaccination status. And it's just very, very obvious that the vaccine is extremely effective when it comes to decreasing the chances of or the risk of being admitted or needing an ICU admission or dying because of the infection. And that applies to both children and adults.
Another parent is asking, where can I get reliable references and information on COVID-19?
My personal favorite is the CDC website. They have many resources. All of these are updated regularly. All of them are vetted. They have them actually in a very easy language to follow for healthcare professionals and also for anyone really, for parents, for individuals, just to read and get information. There are several other references. You can go on the NIH website. You can go to the California.gov website. And we also have many resources available at Valley Children's website as well.
That's right. You can go to valleychildrens.org/COVID-19. Someone was asking about clinics for 5 to 11-year-olds. I do know that there are a lot of worried parents who were like, I would feel a little better if my child was getting the vaccine to do so at Valley Children's. Right now for this age group, we're not really taking walk-ins. And so for those of you who are watching right now or later on, if you are trying to receive the vaccine for your 5 to 11-year-old, you can go to My Turn. You can go to the state's website. And if you look, sometimes people have been running into issues when they're trying to schedule groups. So it might be better for you to try individual appointments. But if you do that, and then you put the age range, Valley Children's Clinic should pop up there. And our team, I love it because when I was in there, you've been in clinic when they've been vaccinating children, Dr. Mason, like, you know, it's a nice, happy place. And then it also, I think parents feel secure. But, you know, pediatricians' offices are also giving doses too, if you want to go that route. But yeah, go to My Turn, the state's website, just Google it, and you can make appointments for your whole family there. So I think we got through all of the questions. Is there anything else that you wanted to say in closing, Dr. Mason?
Yes. So typically around this time of the year, we also start seeing a spike in influenza cases. So if your child is eligible for the influenza vaccine, so that's any child 6 months of age and above, please go ahead and do that. Luckily, we have not seen too many cases of influenza so far, but again, I anticipate that we will start to see some. In fact, on the East Coast, there is also beginning the spike of influenza cases. For RSV, another respiratory virus that's common around this time of the year. In fact, we have been dealing with many of these cases over the past few months. There's also a sort of immunotherapy or a preventive medication that some children less than 2 years of age can qualify for. So if someone has a child less than 2 months of age, they have risk factors such as having chronic lung disease, congenital heart disease, or they were born prematurely, so very early prematurity, then they may qualify for that option. Please discuss that with the child's pediatrician to see if they qualify. So again, there are several things that can be done to try our best to keep our children safe throughout this season.
Dr. Mason, thank you so much again for your time. I know we haven't done these in a while, so and I know you're also very, very busy. So thank you. And for those of you who still have questions, feel free to leave them in the comments. And we will find those answers for you. Valley Children's is here for whatever you might need to know. And we're also here to help you vaccinate your kids. So go to My Turn and schedule those clinics. Again, all the information is on valleychildrens.org/COVID-19. Have a great day. Stay safe. Try to stay healthy. And we'll see you back here next time. Thank you.